in the most recent, I'd say about 2 to 3 months, we had been seeing this patient for depression and OCD. Now, our clinical director, Mr. William Schreier, had previously been seeing this patient for psychotherapy for some time. Now, he had been discussing TMS with the patient, and she thought that it was worth giving it a shot. So we saw this patient for 30 sessions, and by the end of her treatment, she was almost like a whole new person. She told us that she got her mom's superpowers back, and that was very, very special to her because due to the depression and OCD, she felt like it was inhibiting her from being the mother that she knew she was able to be. Now, after TMS, we follow up with patients, of course. Now, we had a bit of a problem because she was back living her life. In fact, when we finally got a hold of her, she said, "I've been too busy to call you guys." So that goes to show that the depression had lifted, her anxiety had improved at almost 100%, and her OCD had almost gone away. And that is very important to us because we find that a lot of mothers and people in general, they feel that depression and OCD is the end. But once they learn about TMS and they actually have TMS, they are able to see that there are other options available. And it's not anything similar to ECT, which a lot of people might have in their mind when they think about TMS and, using technology on the brain. However, I'm happy that we were able to get her back into gear, and she is out running marathons.
How many sessions did she have approximately?
She had 30.
30 sessions.
She had 30. Initially, they were only going to authorize, the insurance was only going to authorize 15, and we fought for more sessions, and at 30 sessions, she felt, and we felt like that was pretty good, and we let her know she's always welcome back for maintenance if necessary. Now, some patients require maintenance, some don't. It just really depends, and it also depends what their psychiatrist is recommending to them, and sometimes we are able to participate in that, and sometimes we're not. But mostly we find that most patients don't really need maintenance for TMS because I'd like to think we have an awesome team here, and we treat the exact area that needs to be treated, and we listen to the patient, and we almost become like the patient's diary while they're here with us. So I think that a lot of other technicians could learn a lot from Blackhawk TMS. When we are in there, as Mr. Schreier had mentioned, we're getting to know the patient, and patients know whether or not you're being sincere, and I'd like to think we could pride ourselves in being very authentic with our patients, and we hold the bar high.